We are going to go ahead and get started. My name is Mary Ramos, and I'm very happy to present our presentation, at least to open it up. This talk is, I believe it's C4. Teens talk about school-based health centers in New Mexico, what we've learned about barriers to access and utilization, and what we need to do. We, all of us who are presenting, have no financial conflicts of interest to disclose. I am an assistant professor of pediatrics at the University of New Mexico, and I am joined by Dr. Christina Perry, also from UNM, University of New Mexico College of Education. I'm also joined by Yolanda Cordova of the Office of School and Adolescent Health of the New Mexico Department of Health. And I'm also joined by Micaela Cadena and Diana Garcia, both of Young Women United, a truly fantastic community organization here in New Mexico. In brief, we're going to talk about 3 studies where teens talk about school-based health centers and we listen. Christina is going to talk about a study relating to middle school students and school-based health centers. Yolanda will present a study we did here in Albuquerque, New Mexico, getting input from high school students about school-based health center services. And then Micaela and Diana are going to talk about a study getting input from young women about their experiences accessing reproductive health services, both at local public health offices and from school-based health centers. So with that, I'm going to turn it over to Yolanda Cordova, who will make some brief comments and sort of set the stage about the New Mexico School-Based Health Center program. Thank you. I'm sure you're going to enjoy this talk.
Okay, so now I need to orient myself here to this. Is it just the page? Okay. So in New Mexico, the first slide that I wanted to present is just to give you a context of what our state looks like with regard to school-based health centers. And so each of those shaded areas is what we call a region in our state. So we have 5 health regions, 5 public health regions. And every place where there's a little school, all those are school-based health centers. So in New Mexico, we have roughly about 79 operating school-based health centers statewide. But as you can see, there's a huge concentration up in the north. So we tend to be heavily situated up there. And so let me see, what else do I want to say about that? Our sponsoring partnerships for our school-based health centers are broken down like this. We have, and these are the sponsoring partnerships that we have with the New Mexico Department of Health. So they're in a contract with us to actually operate centers. Even though there's about 79 in our state, we are operating 56 that come through our office with a contract. The others that are operating in the state are done through partnerships with Indian Health Service. Some of them have actually gone over after their own 330B money with FQHC status, and then some are just operated through schools, where the schools have actually just pulled their community together and have done that. So there's 56 in our little rubric with us, and of those you can see 24 are sponsored by FQHCs, 15 by university programs. We've got regional educational cooperatives, which is kind of a unique situation with us. Our educational cooperatives are exactly as their state, a cooperative, and what they do is they purchase ancillary services for smaller school districts. So they pool their dollars and can purchase anything from speech pathology, occupational therapy, and all of those ancillary services. And now they've taken on this partnership with us to run school-based health centers, and they're actually employing nurse practitioners and behavioral health providers and doing the administrative oversight. And then we have 2 that are hospital affiliated. So we're actually, these are rural hospitals that have taken on sponsoring school-based health centers, and they're using their hospital administration to support it. And then other community-based organizations include, we actually have some community mental health organizations that are doing the mental health piece, but also sort of branching out, doing an integrated piece, and bringing in a nurse practitioner to support that. And then we've got some like nonprofit organizations as well that are either they're just like community-based nonprofit organizations or child-serving agencies that are supporting school-based health centers. So, the other thing I should have mentioned, this session is being live streamed. So if you have questions, you have to get up and go to a microphone, okay? So that's one of the things. So you can't just like raise your hand and talk. You have to actually come up to a microphone and talk to us through there. Let's see, what else do I want to say there? Oops, I'm in the wrong place. That's it. I think now I'm going to turn it over to Christina. She's going to talk about the study that she did.
Great. Thank you. Good afternoon, everybody. How are you? I just want to do a scan in the room and find out who in here considers themselves a staff member in a school-based health center. Doc, nurse. Okay, and how many of you are directly involved with evaluation of school-based health centers? And how about researchers? Any researchers in the room? Anyone want to admit it? There you go, a couple of you. All right, well, thank you very much for coming to our presentation today. My name is Christina Perry, and I'm a faculty member at the University of New Mexico in the program called Community Health Education in the College of Education. And I had the great privilege of working with a research team to try to understand perceptions from kids regarding school-based health centers. And my colleagues are on the screen, and I'd like to acknowledge them. Dr. Ramos, who just left, Dr. Sean Hernser, and colleague Kira Ryan. Our study involved kids and staff, and so I want to first just start by sharing with you why this study. Most of us in here would agree that school-based health centers theoretically work, that they increase access to quality healthcare services for a lot of kids who need it. They also provide a safety net for those kids who otherwise may not have access to health care or access to health care in a timely manner. Some evidence shows that school-based health centers also increase seat time. Kids are in school, they're available to learn. It also decreases absenteeism, tardiness, and early dismissal from school. Some of you probably have experienced this. In New Mexico, our families bear a disproportionate economic and social burden compared to the rest of the United States. This slide shows that New Mexico ranks 5th in the nation for children living in poverty. 25% of New Mexico's children under the age of 18 are impoverished. And this places us 3rd in the nation for children lacking health insurance. So school-based health centers are important to us in New Mexico. There are about 81 in New Mexico and 58 that are supported by the Office of School and Adolescent Health through the Department of Health. But evidence shows that school-based health centers are underutilized. And the question is why? So a group of researchers came together to try to pull together some meaningful questions that we can answer within a school period. And my study is sharing the findings that we discovered talking with kids at the middle school level. There are 2 aims to our study, and I'm going to communicate only the first aim to you because of time. One, to understand students' perceptions of and reasons for not using school-based health centers. So we really focus on kids who are non-users. And then we wanted to also explore the perceptions of teachers and principals, school staff perceptions of school-based health centers. And although I'm not presenting that data, I would be more than happy to answer any questions and share that data at the end of the presentation. But essentially, we were able to work with 20 eligible rural schools that are serving underserved or uninsured or underserved students. We wanted to look at schools that were not a frontier school, but a rural school, and an Elevate school, which is a model that's somewhat unique from the rest of the school-based health centers. They're uniquely funded, and they have a very rigorous evaluation component to their school-based health centers, so we eliminated those schools to try to create a homogeneous group. And so we've decided to focus on 7th grade students who I self-identified themselves as non-users and who are also English literate students, and were willing to participate in a focus group with strangers like ourselves. So our methods essentially were to conduct focus group discussions, and here are our questions. We were interested to find out whether they were even aware of school-based health centers, and if they were, what kind of services might be provided by the center. We wanted to also know who would influence you to access the school-based health center if you could, and what perceptions they had about their center, if there was a stigma associated with their center. We wanted to know if they thought that there was any barriers to accessing it, so that we could address that in all kinds of ways at different levels. Also, their perceptions of whether it's needed. What are the benefits? What do you think you can gain from going to a school-based health center? And then if you were a queen or king for the day, how would you create a school-based health center? And that was a really fun question. Some of those answers we omitted in the presentation, but I'm going to share some of those with you. So we conducted 11 focus groups across the state. A total of 52 seventh graders spoke with us, mostly males and 46 Hispanic students. And they were from rural middle schools in northern, western, and southern New Mexico. So the next few slides just share some of the findings, and these are just the highlights. And as I'm sharing these findings with you, I want you to ask yourself two questions. One, do you experience this in your neck of the woods? Do you think kids would say this, or are they saying these things? And the other question is, if you had to do something about it, what would you do? So when we get to the end of our study, or our presentation, perhaps we can share some of the implications and how to address this. Most of the kids that we talked with they didn't know what a school-based health center was. They didn't know that there was one at their school, and they were uncertain as to what kinds of services that they provided. Despite some of the grand efforts of staff in school-based health centers advertising and promoting, a large percentage of the kids still did not know what a school-based health center was. The majority of them were just unsure of what services were provided, and they were confused as to what services a school-based health center would offer that would be different than what the school nurse offered. The other important question was, what are some of the sources of awareness? How did you know about the school-based health center if you did know about it? And do you perceive that it to be a need? Is there a need for school-based health centers? And most of the students the students who had heard about the school-based health center learned about it mostly from their parents and teachers. So it seems to us that parents and teachers, as most of the research has indicated, are really the first line of defense in creating a supportive climate for school-based health centers and moving those kids to that center. Posters were helpful, but they weren't very interesting. They were very small print, and they were adult-like. The kids kept saying they're too adult-like. And they tend to be located in one area of the school, typically closer to the school nurse or the principal's office. When we did describe to the students what a school-based health center was and the kinds of services that it provided, they believed that there was a tremendous need. And many of them said, especially for mental health. And we were impressed that they actually coined it mental health. And when we probed a little bit, a lot of their friends were suffering from depression. And not only did they think that their friends needed to access the school-based health center if that's what was provided for them, but they wanted to know, how do you help a friend who is depressed? What are those skills? Who would influence your decision to use the school-based health center? And there was a difference between males and females. The girls reported that their parents, and mainly their moms, influenced their decision about using school-based health centers. Friends had very little effect. However, with boys, friends were salient to them, had more influence than their moms or parents, in both negative and positive ways. Boys overwhelmingly said that when teasing would occur, if there was any kind of teasing, oh, you're going to go to the school-based center, we know what you have, they absolutely would not go back. But if their friends had good stories to tell about the school-based health center and the outcomes, then they would be more likely to visit and try it out. So the influence, the individuals of influence are somewhat different across gender. Reasons for non-use, most of the students indicated that they already received health care from a primary care doctor, and that they simply didn't have a need for it because they weren't sick. And if they were sick, they would go to their mom, and their mom then makes those decisions for them, which made us kind of think that middle grade students are still somewhat very dependent on their parents when they're making choices about their health and when they're sick. When they feel sick, they go to their mom takes over. So they really haven't developed or refined those skills that are required to navigate when they access the healthcare system. When I'm sick, I don't have a choice. I go to mom. Mom makes the rest of the decisions. Somehow when they get to mid-high school, they have some of these skills. So it was really relevant or important to us to try to look at and study, think about what are ways in which we can get middle grade level students to start thinking about choices about health, choices about illness, and where do you go when you're sick if your mom's not there at school. So helping them develop those navigation skills and accessing healthcare services, I think, is really, really important. I wanted to make one more point here, and that is kids associate school-based health centers with being sick, not with wellness, not with a place where I can get more information to remain healthy, to be healthier, or to get weller. And that's sort of our healthcare system. It's sort of set up like treatment and less focus on prevention. So prevention-focused healthcare services are something that we could probably change. What keeps students from visiting the school-based health center? The question was, if you could, if your parents allowed you to visit the school-based health center, what would keep you? And mainly the girls said that there needs to be female doctors. And we asked, well, what about the female nurses? They said, well, the nurses aren't really doctors. So it seems to them that nurses know a little bit less than doctors. And I have an opinion about that, but I won't say it. So, and many of them had perceptions about privacy and confidentiality. Now, all these schools were rural. How many people are in here are from a rural town or small town? So you understand that your aunt might be the school nurse, and then your aunt tells the mom, so sometimes news spreads in a rural or small town, and it gets around. And so kids were kind of concerned about what is private. How do you keep things confidential? In some cases, some of our school-based health centers are in trailers, and trailers have very thin walls. And kids indicated that they could hear. They couldn't hear specifically words, but they heard noise. And so to them, that means that everyone can hear your business. So those were kind of the issues that they talked about. We asked them about, do you know that you have rights? And they didn't understand those. And I'm sure that's across the board nationally. Being unfamiliar with the doctor and the staff at the school-based health center. When given the opportunity, they'll always go to the nurse because they've established that relationship. They see him or her every day, and that would be the preference. Perceptions that staff provide substandard health care, and we've talked a little bit about that. I think it's just mainly because they're unfamiliar with what's happening in that clinic. Cleanliness, location, and structure. Some of our school-based health centers are across the street from a school. So how many people have that where it's based in the school, but it's maybe outside the building, school building? Okay, several of you. So students can see other students walking to the school-based health center, especially if the building's right in front. And so inevitably that's going to cause or create 1 or 2 stories by lunchtime. So if you're seen walking to the school-based health center. And needing parental approval, that could be a barrier because if they wanted to go but the parents didn't approve of them to go, or a lack of support. I want to go, but my mom doesn't support it or has misconceptions about what services they provide. then that would be a barrier for students. So you'll see that this has tremendous implications for marketing salient messages to kids as well as community members. The last question that I want to share with you is, if you were in charge for the day, and we worded it, if you were a king or queen for the day, how would you change the school-based health centers, or what would you prefer? And they said more choices. Girls would prefer female doctors. They would require that the doctors or the nurses visit their classrooms, and that they wanted a field trip to the school-based health center. Expanded hours. Many kids indicated that their friends or they tried to access the school-based health center after school, but it was closed. So giving tours and I talked about location. Providing candy, fruit, and playing cool music. And we really got probably 120 different artists, and I recognize one of them. So cool music, so we had to think about that. Services, and I thought this was interesting because we had listed for them services that school-based health centers typically offer, and they wanted nutrition. They wanted information about nutrition, and we probed about that in terms of what kind. The kids who were athletes or in after-school sports had different interests than others. But weight loss, healthy weight loss. They wanted counseling services, and the girls wanted to talk about female issues with a female doctor so you wouldn't have to use those personal words, which was interesting. They couldn't even use the language. So, and then overwhelmingly the students said, let the students promote it. And I'm going to turn it over in a minute to Yolanda, who will share how they did that. In summary, I think relationships are important in trying to connect these strange people who can really help kids, doctors and nurses, with the kids. They need to talk with you, they need to see your face. I go to real doctors. How do I know if they're really good? So becoming familiar with the process, and that it might not be any different than what they've experienced with a primary care doc off the school base location. I don't know how to use it. I'm afraid to go. So a lot of telling and showing and testimonials and actually getting them to see it was really critical. Okay, I'm going to turn it over to Yolanda Cordova. Thank you.
So I'm part 2 of this presentation, and I'm with the Office of School and Adolescent Health. So I'm with the Department of Health, and our office is responsible for organizing and coordinating school-based health centers across the state. And one of the things that was really evident to us is that the whole issue of underutilization. And so we were fortunate enough to have the help of a CDC fellow that came, and so this is how we were able to pull some of this together. And this, we wanted to know basically also is like, well, what do students think about the school-based health center services? And so this was all focused on, just on working on with high school students. So while Christina was working with middle schoolers, we went and we started to talk to high schoolers, knowing that that was just the next developmental stage and what was their thinking about it as well. So why we did this study is very much in line with what Christina had said. We also knew from anecdotal information from our school-based health center providers that there was just a lot of evidence that our school-based health centers were just underutilized, that we still had some downtime. And we could see that just by our clinical encounter data. And so our question was just like, why? Why is this happening and what's going on? So the goal for us was just to better understand the perceptions of school-based health center services and the barriers to the utilization. And from that, we wanted to develop and create youth-informed marketing materials, because we thought this would be a good way for us to actually hear from them, this whole youth-engaged piece about getting their input about this and really leading with them or letting them lead us through how to create some marketing materials. So the methods that we used for this, and I want to disclose here right away, I'm not a researcher, I'm not the evaluator. I didn't get to do this, so I am pinch hitting for staff that can't be here today. So I'm presenting this, and please don't ask me hard questions. So, because I just have what's on the slides. Believe me, I practiced, and so it was kind of nerve-wracking. So what we did is this, the study was concentrated in Albuquerque, New Mexico, which, right in here, so it was an urban setting. And we looked with 3 high schools that had very diverse populations. New Mexico is known for its diversity, and so we really wanted to make sure that we had a pretty good picture from our Native American, African American, and our Hispanic population in terms of what was going on. There was an IRB approval process that we went through. We went through UNM and also with Albuquerque Public Schools. That's what APS stands for. And so it's a 2-phase study that they conducted. It was student interviews, and then we led into focus group discussions to help develop the materials. So the interviews, the purpose in that was to develop a profile of male and female student non-users, really with a heavy emphasis on the non-users and their perceptions of the school-based health centers. We weren't so worried about the students that were actually using the center because they were, we had some frequent flyers, we had kids that were coming in, but it was really to get a better understanding of students on these campuses that just what was their understanding of it, what were their perceptions. And so we, again, targeting a diverse group, Hispanic, Native American, and African American students that were non-users. And the major topics of discussion when we were doing the interviews, on these focused interviews with them, was their information about sources for health issues, their knowledge about school-based health centers, and the services that were offered. So we wanted them to tell us and hear from them what they thought. And the perceptions of healthy behaviors, and then some of their ideas about methods of promoting the school-based health center. So the first part with the, so that was the interviews, and then with the focus groups, what we did is we actually were testing the health promotion messages and the materials developed from the information learned from those intense interviews. The focus groups were sex-specific, and they included about 6 to 8 participants and a trained facilitator and a note taker. I mean, it was very, the one thing I can say about the process that was used, it was very intense, and it was very intentional about making sure that we got really good feedback from the kids, and we were really understanding and listening to what their concerns were. So who participated in our study? There were the interviews. There were 50 students that were actually interviewed, and so if you go back to that first part, they were all, there was a note taker, there was a lot of information, some of those were recorded, and so they were all under 18, and again, with those 50 interviews, it was a real stratified study with the number of students that we had that were representative of each of those populations. And in the focus groups, there was a total of 44 students. They were mostly female, and they were all, again, also students that were under 18 and that were currently enrolled at that school. So what we learned from this is that many of the students were unaware of the school-based health center. I mean, we've been saying that already. They had no idea where it was located. These were all the non-users, so we've got to remember these were students that weren't used to even like going to the center. So, but for the majority of them, they didn't even know that there was a school-based health center, which was really kind of like frightening for us. We're like, oh my God, how can that be? We've done such a good job. We're thinking that every student at that campus known, especially. I was thinking like with one of the schools being at Albuquerque High, for example, long time school-based health center. It's been there for a long time. But you can tell, I mean, students are coming and going. They've got a 4-year stay at that school, and you would hope that they would know that the center was there. But that was one of the things that was most surprising for us. There was a lot of confusion about whether the school-based health center was the same as the school nurse's office. And for this one really hit hard for us, and I see one of our school health advocates in the room. We did a really good job at the beginning of this expansion when we were adding new school-based health centers, is we were working so hard at integrating the awareness and the services and really working hard on the coordination and collaboration between the school nurse and the school-based health center, because we wanted there to be that energy and that cooperation between the school nurse and the school-based health center. But I think what we ended up doing is that there was some confusion about, so where does it start and where does it end? And so that was one of the things. They couldn't really tell us the difference between the school nurse's office and the school-based health center, and how they might be different. And most of the participants couldn't even name the services that were at the school-based health center. That was part of the interview process, is can you tell us, what's going on there? And the majority of them could not name the services offered by the school-based health centers without some sort of prompting. I mean, we had to sort of like, well, what about, like counseling? Oh, yeah, we think that might be there. So when we asked the participants, what kind of services would you like to see there? I mean, this was also part of the interview, so it was, again, asking them what they knew, but then also sort of prompting them and asking them, what should it look like? What kinds of things would you like to see at the school-based health center? And overwhelmingly, these were like, the four main services were cited as the most likely to be accessed. I don't think there's too much surprises here, especially for this room with the folks that are in the room. Obviously, treatment for injuries and illness was, at the top of the list. They wanted to make sure they could go there and they could get that. Counseling, mental health is definitely something that was coming up. A nice opportunity to go and talk with somebody. Sports physicals at the high school level, obviously really important, since there was a lot of students that didn't have access to a provider out in the community. They thought that getting your sports physical through the school-based health center would be a really good idea. And then last was sexual and reproductive health services. That made a lot of sense to them, that would also be a service that would be available for them through the high school, school-based health center. And we asked them what were the perceived benefits to use the school-based health center. And again, this was, I don't think there's a lot of surprises here either. They, thought it would be a very positive place for students, because this would be a way for them to be engaged in learning something about health care, their wellness, and that, this would be a good place for them. It was important for students who may be injured, ill, or who may be injured or ill at school. So they saw that as a convenience, that was definitely another perceived benefit. If I'm at school and I get injured and I can't get somewhere else, obviously this is a great place for me to go. They also thought it was important for those who may not have regular health care provider or have health insurance. So what was interesting about this is that for the non-users, even whether they had insurance or didn't have insurance, they really also cited that as an important factor, that there might be students that don't have access to that, and that this would make a lot of sense, that this could definitely fill a gap for students who didn't have access to care. And then the last one was obviously the whole issue around confidential services, that this would be an opportunity for them to be engaged in like their reproductive health, or even in some mental health counseling on a confidential level, and be able to access it. Those would be some good benefits for them. Then we asked them what were the barriers to using the school-based health center, and obviously the top of the list was just a lack of awareness. They didn't even know, that it was there. The second one is really interesting, around a lack of perceived need. A lot of the students believed that they just were not in need of services. They either had insurances, or they had a provider, they had access to care. So they just didn't really think that, they were well, they were healthy, so there wasn't really a need for them to have services. They did lack general awareness of confidential services and their rights. So very much like the middle school students, also at the high school level, they just weren't really aware of their confidentiality rights and the kinds of services that they could access on their own. So that was also perceived as a barrier, though, too, because they didn't understand their rights, and they also just wanted to make sure that they were worried about like parental approval, and being concerned about whether they would lack approval from their parents to go. And this was really specifically important for the younger students. They noted that they would be more inclined to go to use the center if they knew they had their parents' approval to go and do that. Wasn't as much of an issue for the older students, but it's definitely an issue for the younger ones. So after pulling all that information together and looking at it and pulling everything together, basically the communication implications were that the older teens cited more frequently a desire for confidentiality than the younger teens. Obviously, we just said that previously. The younger teens wanted their parental approval to go to the center, whereas the older ones were saying, we feel like if we know our rights, we're gonna access that. African American participants cited doctors more often than parents as a source of health information. That was another piece that came out to us. So we knew that they were also looking at the medical profession to sort of fill the gaps, if you will, about some information, and they trusted information that was coming from the healthcare industry. Whereas Hispanic and Native American participants preferred their parents to doctors as sources for healthcare information. So that was really pulling that information out for us obviously had some communication implications for us as we were going to pull our messages together and sort of thinking about the cultures in a different way. So in summary, what we heard from students is that's like, tell me about the center and helpful services that are offered. And we want to know what's there. Explain confidential services, then keep my visits confidential. I mean, that was the other issue. They're worried about it. They want to understand their rights, but they're also really concerned about, is it really confidential? So that was a real key message. And then reassure me about friendly professional providers. We wanted to make sure that they're going to come in and that the folks there are going to be friendly, that they're going to be, sort of non-judgmental, they're going to have a friendly face, and that it's going to be something that's going to make them feel comfortable, which fits into that last part about like, welcome me. Welcome me to come there. Otherwise, I might not feel comfortable to going there. So those were those messages. Let's see. So what we did with the summary of those findings is we actually went and led through a youth-informed process so that we could identify some messages about and how they should be conveyed, and then developing some taglines and some images and so on and so forth. And so that's what you see. These posters that are around the room were actually developed by youth that helped us. We looked at all this information, and they actually pulled it all together. And these were the key messages that came out of that and what they thought was important. First one, and they were all focused on the key services desired, so counseling. This one is obviously kind of like one of our favorite ones. The students noted that this tagline sent out a message that the SBHCs were appropriate for both physical and mental health, because you could feel like crap about both your physical and your mental health, and that this resonated with both males and females. And so this one really hit home on how they prefer to talk about feeling bad too. So so you don't say, oh, I feel really depressed or I feel really, down. This is really how they prefer to talk about feeling like crap. So here's another one on counseling, and this one just has an image that shows both males and females and needing someone to talk to. Sports physicals was obviously the other issue that came up, and really wanting to focus on that because kids are really interested in staying active and engaged, and they were really, when we were talking with the focus groups, really impressed. It's like, wow, I could get a sports physical there. That's a really cool idea. And so this was another tagline and the images that they came up with. And I think the thing that's really unique too about New Mexico and the images that you're seeing is that we also pulled in from all of the cultural groups that we were representing or we were talking to. And then the next one's about sexual and reproductive health. Obviously having a male was really good because they have questions about that as well, and so do women. So it's the same text with different ethnic representations, but it also had both sexes, and that reproductive health is definitely something that's needed by both male and female. So we've done this, and just to kind of let you know what our next steps are with this, we're in the midst of rolling out a poster campaign all across New Mexico in partnership with one of our managed care organizations. They actually were really excited about it, and so our managed care organization is printing up all of these posters, and we're going to send them out to the school-based health centers along with a campaign kit providing guidance and strategies on how to market the school-based health center. So it's going to have some suggestions on, where placement for the posters, plus also just talking about some other communication pieces and marketing pieces that they can use that would be fairly simple on campus to get the word out. Obviously, engaging youth to tell about the school-based health center and to promote it are also part of that. And then we're hoping to find funds to conduct an evaluation of the campaign. Unfortunately, I think with most school-based health centers, we get to this point where we have this really good materials and we know it's going to go out. I really wish at this point we haven't been successful yet, but we're still working on it so that we can see if there's really an increase in utilization as a result of using these posters. So that's the study at the high school, and now I'm going to turn it over to Micaela and Diana, right? Diana.
Good afternoon. My name is Micaela Cadena. I'm the campaign coordinator at Young Women United. We are a community organizing project by and for young women of color. What that means is that we work with women of color and our families across the state to identify issues that are impacting our life and work together to make social change around those issues. So I'm really happy to be here today with Diana Garcia. She's one of our young women and really one of our leaders at Young Women United. And together we're going to talk about this exciting project that we've been working on for the last 2 years. Oh yeah, I was just, sorry. We went into this research project with Dr. Veronica Plaza. She's at the UNM Robert Wood Johnson Center for Health Policy. We were the primary community organization spearheading this project, but we worked alongside the South Valley Male Involvement Project. They're a nonprofit here in Albuquerque working with young men and issues of social justice.
So the reason why we started this research in the first place is because we were concerned of how we as young people were being treated in trying to get health care, and we were also worried about how the quality of care that we were actually getting. So in our study, we wanted to learn the ways young people access reproductive health information and services. The plans we made to make this change are to share knowledge about our rights to health care. We also improved and increased youth access to reproductive to reproductive health information and services.
At Young Women United, we're strong believers in community-based participatory research. As some of you may be familiar with this research model, it starts with the idea that communities carry knowledge, experiences, and initiatives to make change to improve their lives. So here at Young Women United, it wasn't myself on staff, it wasn't our director, it wasn't anyone besides our young women that decided that they cared about what was happening in their lives and their bodies and wanted to go out and see how to get better access to healthcare. So that's the first thing about community-based participatory research. It really starts with an issue of an importance identified by a community most impacted by the situation. Why we love this kind of research is as you bring in the intention of studying and learning about something that matters, you also are building an action plan to make changes based on what you learn. So that's what we were really excited to do here at Young Women United, is to support the voice and the vision of these young women and help them develop a pretty intense research project with the ends in mind of improving access to reproductive health care. So officially, our aims were to study the access and utilization of reproductive health care and services by young people at publicly funded sites. So we were looking both at school-based health centers and public health offices in Bernalillo County. Our grand intention always was to explore systemic issues around young people's access to care, and then to propose policy solutions created by young people, those that are most affected by their access to care.
So how we started our research is that we actually sent 120 youth undercover to go into clinics to see how they were treated. To do that, we needed to do outreach. So once we got our youth and we saw that they were interested, we actually did sessions with them. In these sessions, we kind of give them a sex ed class or whatnot. So they would actually go into the clinic knowing what to expect and if they were actually giving good information. So after they went into the clinics, they either did a written survey or a audio interview. So once we had all of the surveys and interviews, we collected all the data, we analyzed it, and so we decided to take action, which we will talk about in the next few slides.
As we've been able to build our research at Young Women United, we've also been building alliances across the state with people like Dr. Perry, Yolanda, Cordova, Dr. Ramos, and while they have covered many of the same findings that we unfortunately heard of around like access, privacy and confidentiality, we wanted to look a little closer at some of the numbers. And so we're going to talk about the data we collected, because I think while it's telling to say like most people don't know we exist, it's even more striking when we show you the numbers about who knows what. So in our surveys, we looked to get information about the demographics of the young people that were going into these clinics. We looked really closely at their barriers to access and utilization of care here, and really important for us was their overall experience in accessing care. So to us, it mattered if they felt safe, if they felt welcomed, if they felt comfortable in these spaces. So here in New Mexico, as we've talked about, we have all sorts of interesting communities and wonderful communities that make up our state. It was our intention doing this research that we get a sampling of different kind of populations in Albuquerque, so that we could study if there are different issues accessing care across race, age, gender, sex, and sexual orientation. So as you can see there, the great majority of our participants identified as Hispanic. That is a term that got lumped in our media, but the actual identifiers in our community came in different ways. We have many immigrants from Latin America, large numbers of Mexican immigrants, as well as those that identify as Chicano, Mexican American, Hispanic, and so that includes all of those populations. We also have really incredible and vibrant and dynamic indigenous populations here all over the state, and specifically in Albuquerque. We have a lot of urban Indians, so we wanted to make sure their voices and experiences were included here. And we had multiracial participants, of course. Our population sample, about 40% of those that worked with us were from the ages of 13 to 15. The other 60% were in the 16 to 18-year-old category. We had predominantly females. And for sexual orientation, we were really proud. It fits into our organizing principles and ethics that we really include the voices of GLBTQ communities, and specifically GLBTQ young people. So we did have 11% of the respondents identify as something besides straight. In Albuquerque, as in many communities, there's railroad tracks that divide populations, that divide neighborhoods. In Albuquerque, it's interstates, often interstates, railroad tracks, and the river. So we were really intentional about getting participants in all four of the quadrants that are often used, like in public health areas, in school districts, and otherwise. And we did that pretty well. We got a pretty good sampling from all the parts of town. Just to sort of set some of the numbers we're going to look at, 81% of the students that, or the young people, they weren't all actually students, that went into these clinics did receive free lunch at school if they were in school. And as you know, that's a poverty marker. Either in some schools they themselves have a family that needs free lunch, or they're in a school that's so overwhelmingly under-resourced in that community that the whole school would get free lunch. So what's interesting is that when we asked about their own class identification, oops, the upper one is hidden for some reason. A tiny percent identified as upper class. The great majority identified as middle class, with 80% of the students identifying as middle class, and only 10% identifying as working class. So this is where we start to get striking. When we ask participants about where they usually access care, 45% of these young people reported to access care at a hospital. 23% of our participants usually go to a public health office, and only 8% usually use a school-based health center. When we asked where they would prefer to receive services, we saw similar numbers, with the greatest majority of young people preferring to receive services at a hospital. So to clarify again, we did research with young people 13 to 19, but we are living in Albuquerque, and a lot of what our organizing work is and the way our young people did outreach was among their peers and their friends and their relationships. And the reality is, I think this speaks to like the level of health literacy in our families and our communities, but also that while in some of the studies in the rural areas, young people did have primary care providers, that's not the case for many of Albuquerque's families. Like these are families that are living on the margins, and that, yes, in turn, at this point in time, seek hospital services when they need care. So, over 80% of the young people we worked with had no knowledge of services offered at a school-based health center. When we, as happened in the other research projects here, when there was some explanation, like in the survey, about reproductive health care, like if you could get birth control, condoms, health information at a school-based health center, would you? Over 70% said that they would like to get that kind of services at a school-based health center. We're also, as all of us are here at this table, really interested in the quality of mental health care being offered at school-based health centers. Through our state standards and benchmarks, it is mandated that young people get conversations around violence, substance use, and safe sex in the school-based health centers. What was interesting for us here was that the young females got very little counseling around anything, and that the males, younger males, didn't get talked to about violence or substance use, just safe sex. And so we were interested because that for us, that seems like a population in a time in life where issues of violence and substance use would be starting, if not already very present in somebody's life, but there weren't conversations happening around that. And then, yes, for our young women, while it did jump to higher numbers to talk about violence and substance use, that it started off small. And as we all know, prevention and conversations in real relationships are often ways that we can impact young people's lives around these important issues. We are also interested in looking at coverage. As we all actually, I don't know, did the Supreme Court make decisions? I've been in here and haven't paid attention. But we in New Mexico, of course, care about Medicaid and what happens with Medicaid. And our governor's administration is actually in the process of redesigning our state Medicaid. So for us, as I've said, many families are living on the margins. It's unclear, 1 year to the next when parents may be insured. Often kids might qualify, but because they don't access care for a year, they're then kicked off Medicaid rolls, things like that. So we asked young people about what insurance coverage they did carry. And about half of them said they had public insurance, 10% had private, 4% didn't know, and 31% said very clearly that they were uninsured. We didn't test this anywhere. We don't know if those were accurate, but those were their perceptions about their own insurance coverage. We then asked whether or not they were offered to enroll in publicly funded insurance, which is supposed to be happening at every visit, and 87.7% said they were not offered to enroll. So for us here, there's a discrepancy in numbers. If 31% think they're uninsured, yet most of them are not offered to get on public insurance, it really limits their overall health care. One, school-based health centers could be getting better reimbursements if people are on Medicaid, but two, if there are needs that these young people could have served outside of the center, they're not getting enrolled in order to have their full health needs met. We love these posters here. When we think about printed health education materials, actually Young Women United hosted one of the focus groups when they were developing these posters. And I'm proud to say our young women, in their first iteration, The sex ed posters did actually all have young women pictures, or pictures of young females, and it was our young women that noticed that and said, hey, let's stop here. Obviously, there's people of all sorts of gender identities that are having sex, and let's make sure that's represented in the posters. So I think it speaks to the strength of our young women, but also really the openness of the Office of School and Adolescent Health to be genuine in that work, to take the insight of these young people. So again, this is public health offices and school-based health centers, but a quarter of the young people we sent in undercover didn't notice any printed health materials. And in all the visits I've ever made, I'm pretty sure that every single one of those clinics had them somewhere, and they just weren't noticed. Some of them just straight up said no, they didn't have any materials to take, which again I think must have meant they didn't notice them, or didn't know they were free, or didn't know they could just go and choose whatever they wanted. And it was sort of reassuring that about 60% said yes, there was some for me to take. As we've heard in the other presentations, the rights of young people to private and confidential services, especially when you're talking about reproductive health care, that is their legal right to get confidential services, that about half of, it was evenly split between those that didn't notice any descriptions or printed materials that described their confidentiality and privacy rights, and half of those that did notice.
So we as young people want and need accurate health information based on our realities. You know, you have to tell us about school-based health centers and what it is that you guys offer. Ask us about our issues when we get there. You always have to be working on building a relationship so we can talk to you honestly and tell you the truth, because then we're absolutely getting nowhere. But also help us access health coverage so we have better access to health, so we have what we need and you guys get paid. It's a win-win situation there. So youth need exciting media and places where we hang out. So Young Women United is actually working on a video for this, but also most teenagers have Facebook accounts, and then the posters are great. I actually forgot about these posters, and they actually are better than a lot that I have seen. And also like blogs and other stuff that we use a lot would be very helpful.
Thank you, Deanna and Micaela. I just wanted to wrap up our presentation by bringing together some of the common themes across all three studies, and then share a last slide about the implications. So what? What can we do about this? On the most part, most of our teens, oops, that's the worst thing you can do, right? I think I'll just, rather than looking back on the computer, I'll just ad-lib. Some of the common themes were that many of the teens were unaware of the school-based health center or its location or the services. There was a lot of confusion between what services were available through the school-based health center and the school nurse. There continues to be issues around confidentiality and privacy protocols. Kids don't know about that, what that means. And when you do tell them, they kind of mistrust it. There's familiarity issues. They need to know who the providers are. They need to speak with you and on their turf in the classroom, and then invite them to the school-based health center so that they can see the rooms and they can see the people working there. I think also an issue is increasing support through parents and teachers that might also enhance utilization. Some of the important implications that we feel we wanted to pass on were that to consider designing or creating this sort of student-led promotional campaign. And what that would require is that you come up with some quite meaningful questions for students and have some meaningful conversations, and putting on the back burner our agenda. And running a focus group, I think, takes some finesse. You want, as teachers and educators and professionals, we want to educate if they give us the wrong answer. But when we actually forget about all that and just listen to what they're saying, there's a wealth of information, and it's precious and it's valuable. And to really listen to what they're saying. What is life in their neck of the woods through their eyes? So thinking about considering student-led promotional campaigns, meaningful conversations with youth, running focus groups if you can, developing salient messages that come out of those focus groups or those discussions, creating ads and posters that are developed by them. Also reducing access barriers, which would include creative and unique ways of getting them to become familiar with the school-based health center. Posters, print material is useful, but could we develop apps? Could we use social media to communicate and reach out to their network of friends? Providing clear instructions on how to access, not that the school-based health center is in room 124, because they come and it's closed. And then now what? So being able to communicate some very clear instructions about how to access it and what happens when you take a step in the door. Assessing or addressing the students' perceptions of fear and mistrust, sort of investigating this, and some of you have done this already, but I think that's really important. And there are gender differences. And even listening to heavy users, what are those? Students who use the school-based health centers a lot. And, some of your databases might be able to, if you can pull this data out, light users and heavy users, they're different. Their needs are different. Usually light users go in to school-based health centers for checkups, but heavy users go in for behavioral health services. So being able to sort of tease out some of the needs of some kids and the light users and heavy users, and what are the access barriers for each one. And expanding clinic hours and services and promoting those services for all, not just for what the kids see as the underinsured or the uninsured, that the school-based health center can be for everybody, and it doesn't cover just being sick, but how to become weller as a student. So, thank you very much. We have a few minutes, and we'd like to entertain any questions that you might have. But remember, you have to go and make your debut at the microphone. Lisa.
Hi, I'm Lisa Burke from Boston, Massachusetts, a school-based health center north of that. Your posters are amazing, and I know, just like all of us, funding is not in volume. So how did you pay for them? I mean, they really portray the kids' feelings of pain or, sadness, and they were really well done. So
through the Office of School and Adolescent Health, we had a really small budget. We also had a lot of goodwill from a media consultant who got really excited with us around doing this. So the images were created that way. That was the first way. Now we have a partnership with one of the managed care organizations in our state. So the managed care organization is actually printing all of these and we're going to make them available to all of our school-based health centers that are funded through our office. So that's how the partnership, we wouldn't have been able to do it otherwise, but thank goodness for our sponsor, Molina Healthcare, is going to be printing our posters for us. You have to get to the microphone.
Hi, I'm Jan Marquardt. I'm from Los Angeles, California, and I've been doing this a long time. And something that struck me about your middle school and your high school clinic, and I don't know the answer to this, but it seemed like parents are something that we're overlooking a little bit, because the kids want permission from their parents, and they want approval, and they want to go to there for health information. And we have a heck of a time getting to parents in the high school clinic. The middle school is not so hard, but high school, but it just seems like there's got to be a way of getting to the parents, because if the kids are looking to their parents for permission or approval or whatever, maybe we need to think more about getting to them somehow.
That's a really good question, and I don't have an answer to that, but what I do know is that if the students are confused, it would explain why parents are confused, because the print material sometimes doesn't reach parents. And we've got to find a better way to communicate with parents. Is it, back there, is it okay if we ask the audience questions? Yes? Yes, okay, great, thank you. I didn't know how this worked. But I did want to ask you, does anyone have a way in which they've sort of worked that through? How have you communicated with parents that really worked? And you have to go to, Lisa, you'll have to go to the mic real quickly.
On your way up, I just wanted to clarify that there is that situation when young people have any questions, concerns, thoughts around their bodies and sexual health, it changes drastically. They don't want their parents anywhere near that. And just as a really telling example, when Diana and I presented this to a UNM community here in Albuquerque to talk about our initial findings, there was a wonderful, well-intentioned local nurse here at a school-based health center, and she was so mad about our Medicaid research and say, I try to get all of them on Medicaid. After they come visit, I call their parents to see if they're on Medicaid. And it just struck me right away, like, well, yes, she's working hard on one piece. There are very real reasons that young people distrust the confidentiality that's supposed to be upheld, because it is not upheld, basically. So I think even like as we work harder to build in parents, and again, parents use social media, they use all that, so I feel like lots of the same creative ways. We have to just make sure we're never crossing that line while we continue to respect the confidentiality of young people to access reproductive health care.
So I work in a high school, and one of the things we did that sounds so simple, but it was monumental, because we have 6 academies at our high school, almost 3,400 kids, freshman orientation. Get yourself and get the school-based health center staff invited. And we focused on the fact that we did sick and urgent care and physicals. We didn't mention it that evening, so we didn't freak the kids out. But certainly they know, but it's been very helpful in getting our parents on board.
Great. Thank you, Lisa. We have another question in the audience.
Hi, my name is Angela. I'm from New York City, School-Based Health Center. What is the support from the school administration to help promote the clinic? And also, the posters are beautiful, but I know from the principal of my school would not allow the some of these posters up on the walls.
You know, and that's a really good question, because that part hasn't been tested for us fully yet. You know, I mean, one of the things that I can say is with this study, we had great support from the principals to actually engage in the focus groups and to do the pieces. So that was, you know, step number 1 was really good. I think what's really important for us is that we vetted our posters up through our governor's office, which we thought was a really good political piece, because we're in a new administration, and so we were a little worried about actually some of these posters, especially the one that said feeling like crap. We thought, that one's not going to go through, or was it? And actually, that was the one they loved the most. And so one, we think because we went through that process of vetting it that way, that we're also going to get some support up at a really good state level too. With our school-based health centers, I think we have. I just think because of the number of years we've actually been in some of our schools and just the momentum that we have in New Mexico, I don't think that that's going to be much of an issue for us. I think we're going to be able to get through and put our school-based health center posters up. We're working with Molina right now to actually develop that campaign kit. So we're not going to just go and start slapping them up on the walls, but it's going to be a real thoughtful process to engage the school community so that they know that they're actually going up and looking at a way to do it in a way that respects the community, the school community, and also parents and perhaps the students themselves. But we're also wanting to do it as a youth engaged project. So it's actually going to be working with the youth who are going to actually help us to get the campaign rolling.
And as we wrap up, if I can just add to that, at Young Women United, we organize with young people, but we also know that, especially when they're separated from their children, that parents also want to talk about the well-being of their kids. So maybe it doesn't happen in the same room, like we can't be so upfront in front of everybody, but when they're separated, young parents care about their well-being, and what we've also unfortunately noticed in some of our relationships with school-based health centers here is that administrators are often saying, like, you're pulling them, they can't go for visits during class time because we need them in class, and I'm sure you've all heard those arguments. So what YWOO's running this summer is a two-piece working session. We're going to first work with some interested school administrators to talk about what their concerns are and challenges are about hosting a school-based health center and some of the issues that arise from that. Then we're going to talk to school-based health centers, administrators, staff separately, ask them the same questions, sort of like a mediation process, and really work on the education and awareness for these administrators, because we all know the research is there that shows when you have healthy young people, they're going to find better educational success. So we're really working sort of with these groups separately to bring them together and develop new concrete ways of working together, at least in our local area. And the huge piece of that that's so crucial is that parent engagement. While they might get some pushback when we talk about sex or otherwise, we are building like a cadre of parents that care and know that their young people need access to a full range of information and services.
One thing I wanted to mention is that sometimes no from a school-based or from a school administrator doesn't mean inclusively no. So I would start at the point where it's less controversial. They're not interested in controversy. They're concerned about that, and there is some controversy that comes with some of the services that are offered. So start with something. Start with messages that aren't as controversial.
And we are at 4:27 now, so I think it was, just so wonderful to hear from you all and to share. It was so wonderful to share what we've learned, and I think most of us can hang out for a couple of minutes if you'd like to come by and introduce yourselves or hear more about what we're doing. You can find Young Women United on Facebook, as we've talked about social media, and like us there.
Thank you very much.